How are you?
I am fine.
I'm very excited today. Welcome everyone to our primetime webinar. Again, my name is Brenda Blackstock, and I'm the prime advocate for SE Thrive. SE Thrive is a nonprofit organization with our primary goal is to lead South Carolinians to stability by providing innovative and efficient access to quality of life resources. The things that you're going to learn today, you're going to understand the benefits of Healthy Connection Prime program, what plans are offered and how to enroll, identify additional SC Thrive services and programs for caregivers. Healthy Connections Prime is an enhanced program that combines all of the benefits of Medicare and South Carolina Healthy Connections Medicaid under a single Medicare and Medicaid plan to make it easier for members to get needed health services. To be eligible to participate in Healthy Connections Prime, you must be a resident of South Carolina, 65 years or older. You must have full Healthy Connections Medicaid and Medicare Parts A, B, and Part D prescription drug coverage. You must also reside at home or in a community setting in one of the following participating counties at the time of your application. Healthy Connections Prime. This is a quick overview um, for individuals who have full Medicaid, who have full individuals who are dual eligible that have both Medicare and full Medicaid. You are still going to get the same services and the same benefits under the Prime umbrella. You'll still be able to do your doctor office visits, hospital care, adult dental, your mental health services, prescription drugs, including Medicaid over the counter medications, long term care, that is the community long term care Medicaid benefit, nursing home care in certain and specific um, circumstances. You'll still be able to get education and training of care coordinators, members, and caregivers. All of these services, these same services, are pulled under the Prime umbrella with one health plan, one health care card, one point of contact, no insurance premiums, no copays for doctor office visits. My favorite is a care team and a personalized care plan. One of the things that I love to say about the Healthy Connections Prime program, it is like a golden ticket. You can tailor um, the care for your loved one based on his or her health needs, dementia capable training, and palliative care. What does this look like? This all equals to better care by making it easier to get all of your Medicare and Healthy Connections Medicaid and Medicare Part D services from a single health plan. Better value through a care team and a care manager that works directly with you or your loved one and providers to make sure that you or your loved one gets the needed health services. A better health through flexible benefits that help you stay at home with your family as long as possible. This is our county map. I'm so excited to announce that Horry County now is one of the participating counties that's offering the Healthy Connections Prime program. So all of the counties that you see that are shaded in gray, and including Horry County, these are the counties that are offering that are offering the Healthy Connections Prime program. We're covering the entire state. Did you know that 1 in 5 caregivers report a decrease in physical and emotional or social health as a result of caregiving activities? South Carolina Health Connections Prime has added a palliative care benefit for its members. And another thing that I want to also point out about the Healthy Connections Prime program is when an individual um, um, may have to have community long-term care services, when an individual's health has declined to a degree in which they need nursing home level of care and decides to get that care at home through the community long-term care benefit portion. The one thing that I do love about this program is that an individual is exempted from the state recovery. Ways to enroll. A passive enrollment. This passive enrollment is when the department, when the Medicare, when the Medicaid, DHHS will actually enroll an individual, the dual eligible individuals, when they will enroll them automatically into the Healthy Connections Prime program, or you can enroll actively yourself by contacting SE Thrive's contact center at 1-800-726-8774, or you can simply choose to enroll. We can help you again through that process as well. There are 3 plans available to choose from: Absolute Total Care, First Choice VIP Care Plus, and the Molina Dual options. Other ways that SE Thrive can help. You know, the one thing that I love again about the SE Thrive is that our program is designed to connect individuals to the resources in South Carolina that can help them reach a level of sustainability, whether it's through applying for the Healthy Connections Medicaid, whether it's applying through for SNAP, or even the long-term care and other services. SE Thrive is here to help you. Another thing, another program in which SE Thrive is that is helping individuals in South Carolina, well, all over, is I'm very excited about this as well, especially since we've been in this pandemic since March, and everybody is locked in, and we're coming out, but slowly. Our mental health does matter. And our Mental Health Matters webinar series is offered every second and fourth Thursdays at 11:30 in the morning. And so if you're interested in that, you can call our contact center and they can give you more information. Again, and another program too, another benefit of SE Thrive is our financial health trainings and other resources. Again, my name is Brenda Blackstock, and I am the Prime Advocate for um, SE Thrive and Healthy Connections Prime. You can reach me if you need to contact me. My email, bblockstock at SE Thrive, or you can give me a call. My number is area code 803-683-1678. And the Healthy Connections Prime program, we have partnered with SE Links. And we're very excited today to have speaking with us Dr. Debbie Davis, and we also have Dr. Bonita Bell. We're very excited about how SE Links is really on the ground, really trying to help individuals, connect them with resources as well. Dr. Bonita.
Hi, how are you?
How are you doing today?
Good, good. It's very seldom I get to start first as the dentist, so I'm excited about that.
What should I say? Ouch. Okay.
Yeah, we get that a lot. We get that a lot. We
So,
get that a lot.
so Dr. Bell, could you tell us how long have you been practicing?
I've been practicing in Colombia for over 30 years now. I've been practicing at Vista Smiles. I do adults and children. A couple of days a week, I do only children, and then on the other days, I do adults.
Oh, okay. And so, how long have you been working with the SC Links organization?
Probably about as long as I have been a dentist. So um, that just kind of ages me a little bit. But yes, yes.
Well, I will
So,
say I'm going to let you go ahead and speak to us, but you do not look over 30 yourself. But go ahead.
thank you. Sorry for a little bit of the background noise. I am at work and trying to navigate patient care as well. But one of the things I wanted to share is a little bit about oral care and COVID. I know a lot of times we get on and we talk a lot about our oral care. And so some things unfortunately don't change. And basic dental care is something that whether we have the virus with us or not, we want to keep up with.
Mhm.
So I still stress the things that we've always stressed: proper brushing, use of a non-abrasive toothbrush, flossing, and appropriate mouth rinses so that we can keep any bacterial load down. We aren't always able to keep the viral load down, but we certainly can keep the bacterial load down. Um, Even with the mouth rinses we usually recommend are things that don't burn. I know we've gotten used to the burn. People feel like it burns, it works. But honestly, a lot of that burning is from alcohol, and we don't really want that in our mouth. So the one thing about a mouth rinse and why I mention it is because what we're stressing with our patients when they come in is to use just before you get your dental work done, use some type of hydrogen peroxide rinse. It's not that it's a cure for any virus or anything like that, but once again, we're trying to keep as much bacteria under check while we're working in this environment. You'll notice that even when you come in, we obviously have the masking and the social distancing in place, but even the way you receive dental care will be different because we use barriers to try to diminish the aerosol spray, which we know the virus loves aerosols and loves to be in the air. So
Mhm.
anything we can do to eliminate that. It may be a little different. You may find extra things in your mouth, extra barriers that protect your airway and protect the back of your throat. So those are things that you can do on your own to keep, to stay healthy. On our part, we recommend that you get basic care done during this time. I would not push doing exotic things. I mean, we all like the implants and some of the other things that we do, but surgery should be at a minimum. And so we want you to know your risk factors as well as you can so that we can help take precautions. During the shutdown, definitely there was no need to put any patients at risk for the virus. So we have some responsibilities as well on our end. And part of that is to keep our environment as infection free as possible. Obviously, PPEs are a household word nowadays, but we need to know how to use them properly as staff. And I tell my patients and people who ask me questions, a simple eye test will tell you all you need to know. Sometimes just looking around, um, you know, gloves should be used once. It shouldn't be used for, multiple things. You should see gloves being used and taken off quite frequently in a dental office, along with the masking and things like that. You need to make sure when you look around, if you see a lot of clutter, you know, just common sense things that if it makes you feel uncomfortable, my recommendation is ask. Ask the dentist, ask the assistant, is this necessary? I notice you use, I get this a lot. I get a lot of patients coming in from other states, believe it or not, because they're shut down, and they'll say, well, I notice you all change your gloves a lot. Yes, we do. Gloves are very inexpensive with respect to a human life. So we're also working on quality air control. Once again, dental procedures create a lot of aerosols, a lot of things fly in the air. So as best we can move the air and keep that air quality positive, the better you will be in the procedure. Because really, all of us want to keep you comfortable. All of us want to keep you safe. And we don't need you to feel uncomfortable in our environment. So with that, just a little overview. Some of this is very common sense, but I really stress, make sure you ask questions. The dental staff should not be afraid to answer any question you have about how we practice or why we do certain things.
Dr. Davis, Dr. Bell, can I ask a question?
Sure.
Do you know of any, could you speak on any special programs that maybe some of the seniors may get regarding dental? Do you know of any programs?
Columbia has a lot of through the health department, and have some programs with free dental care for adults, basic care. One of those facilities is in the health department at Lexington, and the other one is in the admin building right across from Allen and Benedict on the 4th and 3rd floor. There's a fully stocked dental office. They take up some appointments, and other appointments they take by the way you come in. And so you can get most basic dental care there for adults. And of course they have a children's clinic on the 4th floor that does free dental care for children that don't have insurance or don't have Medicaid, that kind of fall in the cracks there. They have a clinic that takes care of those children as well. And sometimes even transportation is provided to and from for the child and their actual caregiver. I think the United Way actually runs one of the programs there, one of the big sponsors for that program at administration building downtown across from Allen and Benedict.
Okay, thank you.
Brenda, we have a question from the audience.
Sure.
Does Vista Smiles have a sliding fee for those who are uninsured or underinsured?
We don't have a sliding fee for anyone in Vista Smiles practice. We try to refer patients who have a sliding fee to the Eau Claire system, and I know Dr. Davis will speak to that a little bit, or to some of our United Way partners who are doing care in the community.
Good morning.
Good morning. How are you, Dr. Davis?
I'm fine. I just had trouble getting in. So if you would readdress the question.
Well, we're going to actually give you an opportunity at this time to share any information that you would like to about yourself in your office and your practice. So how long have you been practicing?
Almost 40 years. So I've been in women's health care since the early 1980s, and I now practice obstetrics and gynecology as the lead provider at Eau Claire Cooperative Health, which is a federally funded health center. As Dr. Bell said, we do have a sliding fee schedule, so patients who are poorly insured or uninsured are happy to come into our offices. If you have no insurance, we're still very happy to see you, as we have a program which we call the Good Samaritan. We call ourselves Good Samaritan doctors, And so we're able to get you on a sliding fee or a no fee schedule so that you can be seen. Our offices offer, and I do women's health care, but our offices offers internal medicine and family medicine. It offers pediatrics, mental health, as well as dental, podiatry, and as well as we have our own pharmacy, so we can give reduced costs for drugs or some drugs for free for our patients who are registered in the system. Okay. As far as patients' access to care, we have 13 locations across the city and outside the city. We go as far as Newberry, South Carolina. We're in Eastover, Hopkins. We have several locations in Columbia, West Columbia, Casey. We have 2 locations, and as far out as Ridgeway, South Carolina. So if people are having difficulty getting access to care or unavailable or can't get to a doctor in their area, if they would just go to our website or give us a call, we can direct them to the closest clinic that we have and what is offered at that clinic.
Oh, okay. All right. Are there any questions, Ms. Barber? Are there any questions that anybody put any questions in the chat?
Okay. Oh, can I please also add at this time we are also offering through our clinics to our patients rapid HIV and coronavirus screenings. We are going to be relaunching our community on-site coronavirus screening as well as HIV sometime in late October, and those sites will also be uploaded on our website.
Okay. May I ask a question to both of the providers? If an individual had South Carolina Healthy Connections Prime, would they be able to come to your practices?
Of course, they will be able to come to the practices. We do accept all the Medicaid HMOs at the Waverly or the Eau Claire Cooperative, or we'll also call the Cooperative Health. So any of the HMOs and regular Medicaid, we're able to take care of those patients as well as private insurers.
Okay, thank you. Thank you so very much.
And as far as the dental goes, for our children, we do accept all the way up to 21 any insurance that they do have. And our adults, they're limited benefits for our patients when it comes to adult insurance, but we do handle that as well.
Yes, thank you so very much. Yes. Well, I am very excited that you have presented your information. And are there any other, Ms. Barbara, Ms. Stephanie, or is there any other questions?
African American women were among the most likely groups to be eligible for Healthy Connections Prime. Why is it important for this group to seek help from your medical practices?
Well, I'm not sure the study that you're talking about, but there's no doubt across this country that minorities have less access to care. And they are probably in a large portion of the economic status that is below the poverty line, for whatever differentials there are in racial changes in whatever area you're in. Here in South Carolina, we have a disproportionate number of African American women who cannot get access to care because of transportation, where they live, economic status. And because of that, we have to have places and programs in place to help people so that they can get the care that they need, no matter what background they come from. They need to get the care that they need, and we have partners that partner with us. So if they need specialty care, if a woman has an abnormal mammogram and needs to get in to see a surgeon, we can actually get her in to see a surgeon, even if she's uninsured. So, the numbers have always been that way for all minority groups in this country. And that is something politically we need to change. It's going to require a lot of things to happen before that thing changes. before we change and open access to everybody, no matter what. But until then, programs set up across the country to assist women, minority women, especially African American women, with health care and dental care need to exist and continue to exist. And we're so thankful, I am so thankful to be a part of an organization that actually is a forerunner in trying to get women in South Carolina cared for who are unable to be cared for. Thank you. And thanks for the question.
Thank you,
And
Dr.
from
Davis.
my perspective, from the dental perspective, a lot of what Dr. Debbie says is accurate. One of the things that people fail to realize is a lot of the medical problems that you have, especially the metabolic ones like diabetes, can be manifested in the mouth, and we can look at gingival problems, problems with where you have not had the oral care that you necessarily need, and see that it has a connection to the rest of your care. So it's real important that that is assessed or at least identified as something critical in the mouth. Healing from ulcers, the appearance of ulcers, gingival bleeding, dry mouth, all are manifestations of either something going on systemically or the side effects of medication. So dental hygiene at the minimum is something that needs to be kept up, and for some people more frequently than others, because they go hand in hand. And as we all know, our body is interconnected in so many ways. So I would not neglect that. I would certainly make that one of the priorities, one of the many things that you do to keep yourself healthy.
Yes, yes. Thank you so very much.
I was just asking if you could speak to the importance of older adult women continuing their gynecological care. I know my mother had a late diagnosis of uterine cancer because she was in her 70s, and she thought that part of seeing the gynecologist was not a part of her life anymore, so she didn't do that. But if you could just speak to the importance for seniors to maintain.
Yeah, I think that's a common thing that happens. A lot of times as women approach menopause, and definitely past the age of 65, because they have primary care providers who tend to do their gynecological health, and they have less reproductive needs, their childbearing years are over, they tend not to go see their regular gynecologist. However, what every provider should be alert is that as we get older, there are certain gynecological cancers that are more prevalent, are more prominent as we age, and uterine cancer certainly is one of those. Uterine cancer is very common in women who also have certain chronic illnesses like diabetes and hypertension. So any presentation of an abnormal finding on a gynecological exam or an abnormal complaint such as bleeding or spotting postmenopausal, those patients should be quickly referred to the OBGYN doctor, because we're more learned in addressing those problems and getting those patients to the appropriate care. Another thing that women stop doing past menopause is they stop doing breast exams. And there's some studies that show that if you've had normal mammograms after a certain age, you no longer need to continue to get mammograms. I don't subscribe to that. I think that mammograms should be an annual procedure that all women do until the last day of life. However, there are some organizations, and when we start talking about access to care, sometimes even Medicare stops paying for certain gynecological exams after a certain age. Sometimes you can't get a pap smear every year that you might be used to getting a pap smear. They may pay for a pap smear every other year. Some also programs like Best Chance may pay for pap smears or gynecological exams every 3 to 5 years. But that doesn't mean that patients should not reach out if their family doctor is not comfortable, or internal medicine doctor is not comfortable with addressing gynecological exams and gynecological problems. they certainly should quickly refer those patients to a gynecologist. Did I answer your question?
Oh,
Yes, thank you so much.
yes.
You're welcome.
Thank you. Thank you. And I do have, can I actually I just want to have ask a question too. Can you speak to, I was talking with my mother the other day. My mother is, she's almost 70, she's 69. And we were just talking about hot flashes. And I just wanted to know, when do they stop?
That's a great question. They never stop. They don't stop. They might reduce as people get comfortable, as I say, with the lack of estrogen hormonal, because the reason that we go through menopause is because of the loss of our natural estrogen supplementation. The ovaries are no longer producing estrogen, and therefore that lack of estrogen causes what we call the menopausal syndrome, or the menopausal symptoms, or entering into menopause. I've heard a lot of women talk about, as they age, despite the fact that they're in menopause, that they may see a reduction in the hot flashes. But to say that they totally go away in the hypoestrogenic patient, they don't. They don't. So it's always there. But there's some great medications and herbal therapies out there that might assist patients in helping them to get through those hot flashes and those night sweats at night. And of course, we're happy to talk to patients about that, because I know everybody is not interested in a replacement hormone, but might want to consider some of the alternative medications or treatments for hot flashes.
Okay. Okay. Thank you. So I'll let her know.
You're welcome.
We got to ride this out. Okay.
Well, hopefully it'll decrease.
Miss Barbara, are there any other participants who have signed up to speak? We will try to give them an opportunity to speak at this time, or we'll be wrapping up.
Miss Brenda, I do not see anyone right now.
Okay. So I just want to, again, I'm Brenda Blackstock, and the Prime Advocate here for SC Thrive. We just want to thank all of our sponsoring partners, definitely DHHS, Department of Mental Health, Healthy Connections Medicaid, United Way, Molina Health, the USDA, Good Grid, the Duke Endowment, all of our partners for making this program possible. We want to thank all of our participants and our panelists. We thank you, Dr. Benita Bell. We thank you, Dr. Davis. We want to thank SC Links and Ms. Brandolin for being with us, for making this webinar possible. Again, I'm Brenda Blackstock with SC Thrive. If you're interested in applying for any of SNAP or Medicaid, any benefit, you can contact our call center. It is 1-800-726-8774, or you can look us up on the web, scthrive.org. Follow us on Facebook, Twitter, Instagram. We're on all of the social platforms. And again, thank you so very much for being with us today. Again, I'm Brenda Blackstock, and you guys have a wonderful day.